Tinea capitis in children. For most recent updates in pediatric dermatology, refer to the Pediatric Board Study Guide 3rd edition. Tinea capitis, very common, very high yield, very important to know how to make the diagnosis and how to treat. Keywords highly suggestive of tinea capitis. Two words, very important. Alopecia and scaly skin, dirty skin because of the broken hair and the skin is inflamed. Compare that to alopecia areata, the skin will be shiny and clean. Also can be associated with occipital lymphadenopathy. Most common cause trichophyton tensorans. We have different types of tinea capitis. First one, alopecia type. Alopecia type, you will see one or more round or oval areas of hair loss, and you will see the skin is scaly, skin looks dirty, doesn't look clean, with black dots. What will cause the black dots is the broken hair. Why? Because of the trichophyton tensorans. Second type is inflammatory or chorion. So inflammatory, you will see the skin the same, also area of alopecia, and the skin is scaly, dirty, but inflamed, swollen, and tender, and feels buggy, like you feel like a fluid under the skin. It represents an inflammatory reaction to the fungi and occurs fairly late in the course of the disease. This is the worst form of tinea capitis. And the fluid you feel underneath is a pus, so it's a suppurative buggy lesion. The last type I will discuss of tinea capitis, seborrheic type. It mimics seborrheic dermatitis like hair with dandruff. But in the case of seborrheic type tinea capitis, you may see patchy or diffuse whitish to gray scale, thicker than usual, thicker than the regular hair with dandruff. And you may see alopecia, but will be subtle, not complete alopecia like the previous case of tinea capitis. Management of tinea capitis, very important before we start, that you have to know that tinea capitis cannot be treated with topical treatment because the infection is within the hair. So topical treatment will not work. You have to give oral antifungal. The drug of choice to start with, griseofulvin, is the drug of choice. Griseofulvin therapy is safe and doesn't require any routine lab for follow-up. You don't need to monitor for toxicity if used less than 6 weeks. Then you can use shampoo like selenium sulfide or ketoconazole shampoo twice weekly to kill the surface organism to reduce the shedding of spores and the spread of infection. Very important to know that chorion, the suppurative form of tinea capitis, you do not need to do incision and drainage. Instead, you give oral prednisone. Oral prednisone for older children, prednisolone for young kids. It comes in liquid just for 1 week or few days in case of severe inflammation or chorion. This will help a lot to reduce the inflammation, and you will see that the pus will disappear. And follow up in 1 month after the beginning of therapy to complete the treatment. Very important to let the patient know that the hair will come back, but it may take time. If the griseofulvin doesn't work, you can use terbinafine. It works very well as well. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, You will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.